Earlier this year, we met an unrelenting foe, COVID-19. Fortunately, Northwell Health was perfectly poised to manage this unprecedented health crisis, testing, diagnosing, and treating more than 85,000 COVID patients so far. Our strength lies in our culture and people, and in the breadth and depth of our healthcare system. Let me give you an example. Within 28 days, between March and April, 810 patients with COVID-19 were transferred from overrun hospitals to those with more bed capacity. This load balancing underscored the benefits of an integrated health system, where resources and strategic planning played a critical role.
As you know, as the state's largest healthcare provider, the contributions of our healthcare heroes across Northwell's 23 hospitals made a difference for so many. They set a course for care for patients across the country. We never could have faced this crisis without the support of the people in our communities. During this challenging time, we saw firsthand the compassion and the strength that they showed to our healthcare heroes. Their belief in Northwell fuels our ability to fulfill our mission to better the lives of the people we serve. Like many of you, we've been so concerned about the toll that these last several months have had on our frontline workers. And we're so proud of Northwell's leadership, who made employees' mental health and well-being a big priority. We've always called our medical professionals superheroes, but it's never been truer now. And we can't forget, at the end of the day, our superheroes are human beings taking care of other humans, regardless of patient volume, death, and emotional stress. One of these superheroes is Emily Fawcett. In those early and very challenging days, she found a unique way to bring fellow frontline caregivers together in the hope of finding positivity and closure with patients who'd been in their care. Take a look at her story.
Emergency room doctors and nurses have been seeing extremely sick patients come through their ER department in these last couple of weeks, and they intubate them and send them off upstairs in the hospital, and they have no idea how they are doing. And they know that I am a float nurse, so I work up on the floors, so I see those patients, and they're constantly asking me how their patients are doing. You know, they remember every single one of their patients that they have intubated. So I came about with the idea for a hope huddle so that we could share the good news of these patients who are able to get extubated and off the ventilator.
In the last couple of days, we had, 5 patients that came off of respirators. The staff was cheering. And so it was actually like a celebration.
These are really scary times. It's scary to see the patients come in so sick. So I think if we start to hear the positive outcomes that we are achieving here at Lenox Hill, and if we hear that the patients are getting better, they're coming off the ventilators, and they are getting sent home, that will give all of us a little hope and a little light that we need right now.
We'll get through this, and we're going to get through it together.
Hello, I'm Emily Fawcett. It is emotional to see that video again. When the pandemic first exploded in our city, and then across the United States, I think we all wanted the same things. The comfort of our family and friends, normalcy, our regular routines, a break from this new reality. What we needed, though, was hope. And honestly, those of us in the trenches were desperate. We had to know our patients were getting better. Minute by minute, we were grasping at straws to unleash the strength it would take to persist. As you heard, Hope Huddles was something that came to mind late one evening. We had our first huddle the following morning. I could not have imagined what evolved, or the good it would do for my fellow workers. It elevated the camaraderie among us. It increased our empathy for one another. It made us stronger. Despite new fears and the continued challenges of the pandemic, I know we are strong. We are resilient, and we see you, not as a number, not as a demographic, not as a high or low risk category, but you, our moms, our dads, our brothers, sisters, kids, friends, colleagues. You are why we show up each and every day. You give us hope.